The Deputy State Coroner has criticised the treatment of a Sydney man who died of complications after surgery for colon cancer. Ian Patience was 68 when the operation was performed at a private hospital in 2007. He died 10 days later, leaving a shocked widow asking what went wrong.
When Ian Patience went into Liverpool's Sydney Southwest Private Hospital 3.5 years ago, his wife had no reason to believe he wouldn't bounce back.
He was an extrovert, he loved life, he was charming.
Mr Patience was said to look and feel well immediately after the operation, but 2 days later his condition deteriorated. He was tired and developed a chest infection. A week after the operation, he was transferred to Bankstown Hospital, where he died after emergency surgery.
I still can't believe this happened when you've got top private health cover in a top private hospital with a top surgeon. He should not have died.
The coroner says doctors were slow to transfer him to Bankstown, which was better equipped to deal with his condition. He said of Mr Patience, his chances would have been better in a major hospital with appropriate specialist facilities. Ian Patience also suffered from liver disease, but wasn't told this made the operation more risky. The coroner said a 6 to 10% chance of fatal complications is a very powerful medical reason to warn a patient and his or her family about the risks of surgery. As distressing as it's been for Sandra Patience to recall the final days of her husband's life, she says it'll be worth it if the inquest leads to better treatment of others.
The recommendations will save other people's lives, so perhaps he hasn't died in vain.
Specialist groups have been asked to draw up new guidelines to help prevent other patients suffering the same fate. Carl Herr, ABC News, Sydney.